I call to order. I'm Charles McHenry. I call to order the Health, Education, and Welfare Committee. It's April 14th at 10 a.m. I ask the invocation of Representative Osborne, please.
Father, I just thank you for this day and this opportunity to do the business of the nation, Father. I just pray for a special blessing over our nation, Father, our executive branch and all the employees, and the legislative branch as well, and our judicial system, Father. I just pray that you'll guide and direct us, give us knowledge and wisdom, Father. I ask all these things in Jesus' name. Amen.
Roll call, please. Legislative Clerk April Lindsey.
Mary Crawford.
Here.
Mary Crawford.
Here.
Laura Harjo King. Present. Charles McHenry.
Relega.
Thomasine Osborne. Present. Darrell Crocker.
Relega.
Chair, you got 5 present and 0 absent.
We have 5 present, 0 absent. All business will be official. We're going to go to the approval of minutes for March 10th. May I entertain a motion.
Chairman, I make a motion, we approve the minutes with any necessary changes.
We have a motion made by Representative Osborne, second by Representative Lord King Harjo. Roll call vote, please.
Thomasine Osborne.
Yes.
Darrell Crocker.
Yes.
Mary Crawford.
Yes.
Laura Harjo King.
Yes.
Chair, you got 4 in favor and 0 against.
We have 4 in favor, 0 against. Now on down to the order of business. We have TR 26-021, a tribal resolution of the Muskogee Creek Nation confirming the nomination of Cecilia Whitman to serve on the Muskogee Creek Nation Citizenship Board. Sponsor Darrell Proctor.
Chair, motion for a due pass.
We have a motion for due pass. May I have a second? Second by Representative Osborne. Discussion. We have Ms. Whitman here. Ask that if she may step forward, and the floor will be yours. You don't mind telling us a little bit about yourself?
Well, you all know that I'm Cecilia Whitman. I sit on the Citizenship Board. I've been a employee here for almost 20 years, off and on throughout the last 25 years. And I love my job. I love working for the nation. And we've had a trying year here with the tribe, within our office, within our staff that's over there. And I do want to say thank you for always supporting our office, always being there to listen for us and to support us. And we try to be as transparent as we can. I know I do. And with the utmost integrity and honesty as we possibly can. And we appreciate everything, and we love the nation. I take the Constitution seriously, and I honor it. I honor our Constitution. And I love the way it is as it exists now, if I may say that. And I'll answer any questions. If you guys have anything for me, I'll answer anything you'd like to know about me.
Madel, are there any questions from the committee? There are no questions. Any questions from representatives online? Representatives in the audience? All right, we have no questions. I believe we thank you, and then we'll have you come back on pre-agenda on the 25th at 9 a.m.
Okay.
Madel. All right, next order. Oh, roll call vote, excuse me.
Darrell Proctor.
Yes.
Mary Crawford.
yes,
Laura Harder King,
Yes.
Thomasine Osborne.
Yes.
Chair, you got 4 in favor and 0 against.
We have 4 in favor, 0 against. That motion passes. Next, we're all moving on to TR 26-022. A tribal resolution of the Muskogee Creek Nation authorizing the principal chief to execute a terms of service agreement with the Wingard Company for Starlink equipment and services. Sponsor Daryl Proctor.
Chair, I'd like to make a motion for a due pass.
We have a motion for due pass. We have a second by Representative Osborne. Discussion?
Any questions? We have a representative here to discuss. Are there any questions?
The representative, would you mind coming and telling us, briefly about this, legislation, please? State your name, please.
Pete Underwood, Emergency Management Director. This is a cell tower that we have in our possession now that actually provides service back to like the dispatch center to get it back online, or cellular goes out within the nation. Also used to stream back the Horseshoe Bend back to here. So we use it for multiple different things. Right now, we're on a trial purpose with that Starlink. That's actually a part of that. And this is just to go into that. So we'll have that capabilities back to use with the Starlink.
All right, thank you, sir. Are there any questions from the committee? Questions from representatives online? Questions from representatives here in person? If there are no questions, roll call vote, please.
Daryl Proctor,
Yes.
Mary Crawford,
yes,
Laura Harder King,
yes,
Thomasine Osborne. Yes. Chair, you got 4 in favor and 0 against.
We have 4 in favor, 0 against. That motion passes. Next, we move on to NCA 26-041, a law of the Muskogee Creek Nation amending MCN-CA Title 19 5-102 entitled Leave of Absent Required of Muskogee Creek Nation Employees. Sponsor Daryl Proctor.
Chair, motion to postpone indefinitely.
We have a motion to postpone indefinitely. May I get a second? Second. We have a second by Representative Osborne. Is there a discussion?
We met with the chief and HR, and there will be further discussions with HR in the AG's office. That's the reason for this postponement.
All right. Are there any questions from representatives online? Questions from representatives in person? If not, roll call vote, please.
Daryl Proctor,
Yes.
Mary Crawford,
yes,
Laura Harder King,
yes,
Thomasine Osborne.
Yes.
Chair, you got 4 in favor and 0 against.
We have 4 in favor, 0 against. That motion passes. Next, we move on to NCA 26-054, a law of the Muskogee Creek Nation authorizing the expenditure of grant funds awarded from the United States Department of Health and Human Services, Indian Health Services, Suicide Prevention, Intervention, and Postvention Project Grant for the Muskogee Creek Nation Department of Health. Sponsor Laura Harjo King.
Chair, I make a motion to postpone until May's meeting.
We have a motion to postpone until May's meeting. May I have a second?
Second.
We have a second by Representative Proctor. Is there a discussion? Discussion here? No discussion? Roll call vote?
Laura Harder King,
yes,
Thomasine Osborne,
Yes.
Daryl Proctor,
Yes.
Mary Crawford.
yes,
Chair, you got 4 in favor and 0 against.
We have 4 in favor, 0 against. That motion passes. Next, we move to NCA 26-055, a law of the Muskogee Creek Nation authorizing the expenditure of grant funds awarded from the Department of Health and Human Services, Indian Health Services, Produce Prescription Pilot Program grant for the Muskogee Creek Nation Department of Health. Sponsor Daryl Proctor.
Chair, motion to postpone until May's committee meeting.
We have a motion to postpone until May's committee meeting. May I have a second? A second by Representative Osborne. Is there a discussion here? Discussion? No discussion. Roll call vote, please.
Daryl Crawford,
Yes.
Mary Crawford,
yes,
Laura Harjo King,
Yes.
Thomasine Osborne.
Yes.
Chair, you got 4 in favor and 0 against.
4 in favor, 0 against. That motion passes. Next, we move on to NCA 26-056, a law of the Muskogee Creek Nation authorizing the expenditure of grant funds awarded from the United States Department of Health and Human Services Behavioral Health Integration Initiative Grant for the Muskogee Creek Nation Department of Health. Sponsor, Representative Darrell Proctor.
Motion to postpone until May's committee meeting.
We have a motion to postpone until May. May I have a second?
Second.
Second by Representative Osborne. Is there a discussion here?
I have a quick question. Chair.
Representative Osborne?
I'd like to know the reason why we're postponing these until next.
Thank you, Mr. Terry.
Thank you, Chairman. Thank you, committee. As we were reviewing these yesterday with the council office and with the grants office and with the controller, we believe that the technically correct way that these should have been done was to go back and amend the original legislation to add this language into that, not bringing a brand new NCA in here, which is what this has done. So we want to take this month to go back and correct those so that we can amend the original legislation and do it correctly.
Okay. Thank you.
Thank you, Representative Terry. Thank you, Representative Osborne. Is there any questions from representatives online or representatives in person? Thank you for that, Representative Osborne. Roll call vote, please.
Daryl Proctor,
Yes.
Mary Crawford,
yes,
Laura Harjo King,
Yes.
Thomasine Osborne.
Yes.
Chair, you got 4 in favor and 0 against.
We have 4 in favor, 0 against. That motion passes. Next, we move on to NCA 26-057, a law of the Muskogee Creek Nation authorizing the expenditure of grant funds awarded from the Department of Health and Human Services, Substance Abuse and Mental Health Services Administration Center for Mental Health Services Native Connections project for the benefit of the Muskogee Creek Nation Department of Health. Sponsor, Darrell Proctor.
Motion for postpone till May's meeting.
We have a motion to postpone until May's meeting. May I have a second? Second by Representative Osborne. In this discussion, would this be the same reason, Secretary Hill?
Yes, Chairman.
All right, thank you. Is there any questions from representatives online or in person? If there are no questions, roll call vote, please.
Daryl Crawford,
Yes.
Mary Crawford,
yes,
Laura Harjo King,
Yes.
Thomasine Osborne.
Yes.
Chair, you got 4 in favor and 0 against.
We have 4 in favor, 0 against. Next, we move on to other business. We have the Secretary of Health, Mr. Shawn Terry. Floor is yours, Mr. Terry.
Thank you, Chairman. Good morning, committee. No longer afternoon that we do. I would like for us to move in executive session if it would please the council. So that we can discuss some things that we are bringing forward.
Yes, sir.
Chairman, I make a motion to go into executive session.
We have a motion to that we go into executive session by Representative Osborne. May I have a second? Second by Representative Darrell Proctor. Roll call vote, please.
Thomasine Osborne,
Yes.
Daryl Proctor,
Yes.
Mary Crawford,
yes,
Laura Harjo King.
Yes.
Chair, you got 4 in favor and 0 against.
4 in favor, 0 against. Who would we like to be able to stay for executive session? Mr. Terry, the call is yours, sir.
I think everyone in the room now is fine.
Okay. All right, give us just a second while Miss April takes care. We have Chief Financial Officer, Miss Brenda Crawford. Good morning.
I just have a few things I wanted to highlight. When we look at the breakdown of our different funding, of course, the revenues coming in from third party, except for our IHA. Our third party revenue right now for February was 43% of gross, but on a year-to-date basis, it's 46.7. So I looked at last year to see, how are we running, and we were running 46.9. So I'm happy with that because we have payers that are becoming more and more difficult for funding. We have been trying for at least 3 years to get a United Healthcare managed contract in Okmulgee and Tulsa. They will only contract with our clinics in Okemah because they said they have contracts with hospitals in the Tulsa area, which they're also including. So right now they're refusing to contract with us. So any patient that has a United Healthcare managed care fund, we just write it all off. And so that's a lot of money that we're doing. Right now, we're at 42% of the year when we look at February, and our year-to-date expenses to budget are running about 28%. So we're in a good position there. Our collections have been hindered by the fact that you may have heard the Oklahoma Healthcare Authority has laid off a lot of people. And so what that means for us is as we're adding all of these new providers, we have to get them credentialed. And they used to have a person that was dedicated to tribal. They no longer have that. They throw them all into the same pool. And so we don't lose the money. We hold on to the claims until they're credentialed. But sometimes that means we're holding on to claims for 90 days. So now we're asking them, okay, what happens if you have a 90-day timing of filing? What happens? And so right now we're still keeping an eye on that to make sure that doesn't happen. But we're hoping that the Oklahoma Healthcare Association can get, Association Authority can get their act together. Okay.
All right.
I'll be happy to answer any questions.
Any questions from the committee? Okay. Any questions from representatives online or in person? There are no questions. Thank you very much. We appreciate you. Right, next, moving on to Community and Human Services. We have Miss Carmin Tecumseh Williams with us.
Well, good morning, everyone.
Morning.
I'll just a few meetings.
Thank you.
All right, I'm gonna blame all this on Representative McHenry. Called me after and he said, I just need short snippets of what's going on with your program. So you got short snippets. The very first page is just a summary, kind of just little snippets of what each of the programs do. They're under CHS, there are 12 different programs. When I say 12 different programs, SRO, HRO is considered a program under us. Each of the programs, such as social service, which is one of the larger ones, most active ones, obviously. We have anywhere from you have 10 different programs, Iris?
Yeah,
10 to 12 different programs, sub-programs under social services. Children and Family has 9 different programs under them. Center for Victim Services has 8 different programs. So each of those programs has the programs that operate under them. So these are just little snippets that just kind of give you just a real quick idea of what that looks like, each of those programs. On the second page, I tried to label it like number 2. So under number 2 are just some of the things that are going on currently with childcare. Our Okemah and Wetumpka childcare facilities, the brand new ones, are the tentative, and ribbon cutting is set for May 15th right now. invitations will be going out to those that would like to attend that ribbon cutting. And we will open the centers for attendance the following day, so the 16th. The 15th, we will close the other Wetumpka Center so that one, they can attend the ribbon cutting and the ceremony, but also that day they will be moving the lighter things over into their classrooms. There are a majority of the bigger furniture and equipment that's already there, so they will be moving classrooms that day. So that will be on the 15th of May. Our CDCs are also working and attending the meetings with our language immersion program. And with that, what we want to do is be able to bring those language speakers, those that are, especially those that are in the cohorts, into classrooms where our children are consistently being talked with some to with our language. So we are making spaces in our childcare facilities that we will be able to house, or office, should I say, those language speakers. And so we're pretty excited about that. One thing I didn't put on under childcare is that I know that we've all heard that there's been some cuts to our federal funding, which will go into effect for state. Now with those that will be applying for the tribal childcare subsidy, we will be looking at making provisions to see how we can help with co-pays. It won't necessarily be monies that will go directly to parents, but it will go directly toward those things that will help benefit them, such as co-pays or other needs that our providers outside of child care centers are going to need. So we are looking at that as far as we move forward. We know that there will be cuts. So we want to be able to kind of stay ahead and start making plans in order to help subsidize that for for those that are on the tribal subsidy. Under Center for Victim Services, I did attach a little packet that says CVS on it. And those are the different events, Center for Victim Services. This isn't all they do. They do a lot. We have several of our advocates that are standing out in the hallway waiting for court to be advocates for those that have gone through some issues of domestic violence, protective orders. So we stay very active. There's an exhibit. It's a come and go event, and it will be on display. One is today at the College of the Muscogee Nation, and it's called "What Were You Wearing?" And so this is in awareness of Sexual Assault Month here in the month of April. So what were you wearing is a display of how that shouldn't matter what women are wearing, or even men. It's a matter of being protected or being safe in your environment. So that display is ongoing from 1 to 3 o'clock at the College of the Muscogee Nation at the Administration Building. On the 29th, that same display will be at the Council House from 1 to 3. So if you get an opportunity to go over and see those displays, that would be very educational. April 17th, and each of these, the second page has the different dates. It's the green page here, and the different dates on there show just the activities that are ongoing. So there will be, they'll have an honor walk on the 17th, which will be in Eufaula over at Nichols Park at 12. And on the 24th is the butterfly release, and that will be at the Altmulgee Community Garden. And on the 29th, they asked everyone, it's International Denim Day in support of the Sexual Assault Awareness Month. Excuse me. May 22nd will be the completion date at our domestic violence shelter. That will be the completion date. That's the date that is set to complete construction. Everything should be in place. Once they hit that completion date, they will send out an opportunity for everyone, for council and for executive to do a walkthrough of the domestic violence shelter with the tentative opening in June. So, May 22nd, construction should be completed. We do a walkthrough and then we'll, look forward to the ribbon cutting at that point. We also have Developmental Disabilities Assistance Program, which, they also share the month with Child Abuse Awareness Month, Sexual Assault Awareness Month. So April is a big month. And so those are the different dates that are listed that have already happened. The next is the Virtual Training for Family Voices Leadership Conference. And so what that does is it ties all the resources for families that have children that have developmental disabilities, resources that maybe they can access. It's not always financial, but a lot of times they're where to go or who to talk to. Some don't realize what rights they have in regards to IEPs, the individual educational plans. And some of our families just go with whatever the school tells them. They don't realize that they have rights, their children have rights, and the schools have a obligation to provide for the educational experience for our children. And so those resources really give us an opportunity to help educate our families and to help them with their toolbox, with them being able to be advocates for their children. So that's the virtual training will help those families to have more resources. Week of the Young Child, of course, that's the Family Fun Day, April 17th, which actually is a Head Start event, but everyone is involved in that. And we all believe that the Week of the Young Child is an important time for us to really concentrate on the needs of our young people, of our children, our babies. If you get a chance, they will be having some events for that. Our Tribal Juvenile Justice, which is we call it TJJ, Tribal Juvenile Justice, that has to deal with our young people under the age of 18 who have gotten into the system. And there are those that we're not really looking at always being punitive. Punitive doesn't always mean that it's going to help. And so what we want to do is really look at some rehabilitation services, which gave us an opportunity to do so when we contracted with the Oklahoma Mental Health Association. We were able to do that, and thankfully, with Mr. Carey's help, we were able to obtain that contract, which for a building we call Walker Hall. That's the name of their building. We didn't name the building, but it's called Walker Hall, and it's wraparound services. It's a transitional place so that we're not necessarily locking kids up. Not all children need to be locked up. Not all of them, just because they stepped out of the boundaries doesn't mean that they need to be in such a sack and box or detention center. There are some truly that do need that do need to be in those placements, but there are some that truly need the opportunity for rehabilitation and for services that get put in place for transitional living. And that's what Walker Hall is doing, will give us the opportunity to do. And I don't know if I put that in here or not. I did not put Walker Hall in here, but that's what Walker Hall is. So we do have one of those. We do have the opportunity. Our caseworkers work hand in hand with Walker Hall with a weekly update. Excuse me. We staff every week in order to know what will be a good fit. We can't put an offender in with others that may not be a good fit. And so those do go through a staffing process prior to admittance. We also implemented a new program for first-time offenders. So basically it's what you may have heard it called First-Time Offenders Program. But we here at Creek Nation have ours that will give us an opportunity to work with our own citizens, our own youth in regards, and parents or guardian. It isn't just all on the child. We work with both the parent and the child. We have the opportunity to put them through classes, have some goals, set some boundaries for them, help them to go through this process and hopefully deter further, recidivism in this. Hopefully we prevented future offenses. So, and I cannot pronounce that, but it's like finding a path. Nina, is that how you say it? Nina? That's the name of the program. I can't ever say it right. So at this point, we have 24 referrals for juveniles with status and first-time offenders. Referrals are being received from law enforcement, citations, schools, parents calling, and other agency departments. The first 6-week class started on March 23rd at the Broken Arrow office on Mondays from 6 to 8, and the next six weeks class started April 8th in Almagi at the Octagon on Wednesdays from 5:30 to 7:30. And groups are being facilitated in the evenings to accommodate the families. The curriculum being used is Transforming Tomorrow's Youth, which was purchased from the Native American Fatherhood and Families Association for Native Youth. We do have that. The next thing I have is the summer EBT, and I have that on the very top of your page, the summer EBT. So instead of like going step by step, it just gives you the information of what we're doing, where we're at. As summer approaches and children are going to be out, each child will receive $120 they will receive it all in at one time. It won't be split up. They'll receive that. And then it will be utilized. All the tribes that are utilizing the summer EBT will be utilized, such as the WIC, WIC, not like SNAP. Mm-hmm. So SNAP is different than WIC, but it will be the foods, the fresh fruits, the vegetables, the eggs, the cheese, the milk, things like that are on more of that healthy scale. So summer EBT, this is the process that we use, the general eligibility, streamlining how we come to get those things. We were actually able to go through just an MOU with most of the schools. There were some that we weren't able to do that with, but we've been able to get a majority of children's names, information, but also being able to send the information home with them for those that may not have gotten it. So that will begin in May. Well, May, August, so that they will receive it for the summer. All right, last but not least, youth services. We have Royalty Retreat that's coming up. I believe there are 6 that are under the royalty that are going to vie for that. Other than that, I don't have a whole lot more information in regards to the retreat. May 5th, Mother's Day bouquet making workshop. I put the flyer with that, and then June 12th, our youth awards. And everyone is always welcome to attend any of these, any of the events. If you have any further questions, I know it's a lot, and I'm sorry. That's why I kind of had to print it out. I wasn't sure if this is the information you wanted or needed, or kind of gives you a snippet. And do you have any questions?
Any questions from the committee? Yes, ma'am.
You can actually blame me for all of this. But what we can do is, this is not good. They put together this year. And what this will do is help me help you at community meetings.
Got it.
So that's very helpful, because I'll just pick out, by day or by community, wherever I am, about what's going on.
Okay.
So that's why we wanted you here. We're also going to invite education probably the next month. Mm-hmm. So we might alternate you guys every other month, because I think, again, we're trying to help you also by getting the information out there.
I appreciate that. Thank you.
Thank you, Representative. Representative, comments? Yes, ma'am.
Just a comment. Meredith, my daughter, has 3 little ones that are all on IEP, and she got to meet with
Cynthia?
Yes, at the Untitled, and was so and I've just learned about that program since becoming a council rep, and so but the fact that they're able to help with the autism and it's just a blessing. It is, because like you said, and that's true, many of our parents don't know that. They just rely on the schools. They do. And the schools don't know the resources that Creek Nation has. So that was a blessing, most of them.
Thank you. I'll pass that on.
Okay.
Representative Proctor, anything you'd like to add,
I
comment?
appreciate everything.
All right, any representatives online or in person? I would just like to say thank you and just mirror what Representative Osborne says. This really is helpful for us. Gives us a topic to talk about, present to our communities. There are so many services that are out there for us.
Yes.
And personally, not as a representative, but as a citizen, I have used these. And in the past few months that I've been on this committee, I have learned and been able to take these programs out to my family that was able to use them. So not just for our citizens at large, but personally. So we appreciate your time and effort that you and your program and those that work with you have put forward. So I would just like to commend those because I've been to other communities, heard them present things that were very informative to me, and I actually used them. So thank you guys. I appreciate it.
Thank you.
All right. Thank you. All right. Thank you very much. Now we're moving on to announcements. Are there any announcements? Other than the LNC today at 3:30? And then I believe that is it. Make a motion to adjourn.
Move.
So moved. Second. All in favor? Aye. All opposed, same sign. Benediction, Representative Proctor, please.
Gracious Heavenly Father, Lord, you are thankful for being here and being our guidance for as we do in our nation's business. And then I appreciate all of what's been presented today and what the nation is doing for our citizens and all the ones that's here to do that. We are thankful for everything that you do for us. In Jesus' name I pray. Amen.
Amen. And now is 11:11. Meeting. Much. Thank you.